till the end of April. Also, Southfield northbound at Warren, planned construction will bring that down to just one lane from 9 o'clock till 2 o'clock today. I'm Traffic Authority Elisa Z. More weather and traffic in less than 10 minutes.
6:43 is time right now. In HealthWorks, Dina Santafani is here to help us with migraines. If you suffer with those,
man, I tell you, everybody gets those every now and then. Ooh, it's intense. Good morning, Dina.
Yeah, I'm happy that I don't get them, but I know for those of you who do, it's very painful. And there are many ways that doctors try to treat migraines, from massage to medications. But a local dentist says a gadget about the size of this penny might take away your pain.
I've taken just about every migraine medication out there.
39-year-old Nancy Farmer can hardly remember a time she didn't suffer from excruciating migraine headaches, some lasting for 3 days.
I would be basically in bed, cold pack on my head.
So many doctors and so many medications later, Nancy is finding relief from her dentist and this. It's called the NTI device, the only FDA-approved preventive treatment for migraines. It's quite simple. You pop the custom-fitted mouthpiece onto your front teeth, and it prevents you from clenching. Dr. Aragona in Clinton Township says he's amazed at how well it has helped his patients.
For migraine patients or headache patients, it's this muscle that is really the concern, and you can feel it bulge out as you clench.
Put your hands on your head and then clench your teeth, and you will feel those muscles sort of bulge. Then block your bite with something like a pencil. Do it again, and you will feel a difference. But does clenching trigger migraines? Well, it's true some people who get migraines are tooth clenchers like Nancy. Migraine experts at St. John Hospital tell me the headaches are caused by a genetic change in the brain. But many things can trigger migraines, like stress, which can lead to clenching, certain foods or beverages, hormones, changes in sleep, and changes in the weather. The creator of the NTI says in his study, more than 80% of patients saw a 77% reduction in the number of migraines. Nancy says she doesn't need scientific data to know it works.
It went from probably 5 to 7 migraines a month down to maybe once a month.
Working for your health, I'm Dina Santafanti. Now, the cost is $600 to $800, but if you've been diagnosed with migraines, your dental or medical insurance should cover that cost. And speaking of going to the dentist, if you've ever been concerned about the mercury in silver fillings, a new study this morning says don't worry about it. Dentists have been using those mercury-based silver fillings to fill those cavities for about 150 years. Now there were some concerns about the mercury in your mouth. Well, a new study finds that kids with mercury-based fillings did just as well on brain and kidney function tests as kids with composite fillings. Of course, dentists will tell you the best approach is to prevent cavities altogether, so you don't even need fillings in the first place. This morning, doctors have new concern about one cancer that seems to be striking in women